All right, everybody, welcome to another episode of the Physio School Podcast, your guide to becoming a physiotherapist. My name is Anthony Pinto da Costa, and today I'm joined with my wonderful co-host, Mr. Cash Mahdi. Cash, how's it going today, man?
Good, buddy. Been a long time. We've been on a bit of a hiatus, but now we're back.
It's been a bit, but I'm really excited for our guest today to learn more about him and some of the great work that he does at U of S and beyond.
Yeah, me too. So today we have a special guest. Typically, we interview students who go to different physio schools across Canada. But today, for the very first time, we're interviewing a member of faculty. I don't want to drag this on too long. So without further ado, I want to introduce our special guest today, Dr. Scotty Butcher, professor of physiotherapy at the School of Rehab at University of Saskatchewan. Welcome, Scotty. Welcome to the pod.
Hey, thanks, guys. Cash, nice to see you again. Anthony, it's nice to meet you. I know we've connected on social media, but never face to face here like this. So yeah, happy to be here, guys.
Yeah, pleasure to have you. It's awesome. Thank you so much. We're making the big leagues now. Now that we have faculty on board, sky's the limit. Yeah, so uh, let's get right into some of our questions. So first, what we want to ask you is just to introduce yourself. Tell us a little bit about yourself, what you do at U of S, some of the courses you teach, as well, where you're from, where you went to physio school, any fun facts that you have that you want to give the audience before we get into some of the hard-hitting questions about U of S and about some of the things that you do at the school.
Yeah. Yes, Dr. Scotty Butcher. Yes, I go by Scotty. I actually have a funny story. So maybe this is my fun fact. I had a student, a master's student who was trained as a physio in another country. Didn't yet have her license here, but she wouldn't call me Dr. Butcher. Or actually, she wanted to call me Dr. Butcher, and I said, no, you can't call me Dr. Butcher because that's just too formal. And so I said, just call me Scotty. She couldn't do it. She couldn't fathom the idea of calling me something other than Dr. Butcher. So we settled on Dr. Scotty. So you'll hear that every once in a while too. So, but anyway, yeah, no, associate professor at the University of Saskatchewan in the School of Rehab Science, teaching physiotherapy, and my expertise and the teaching that I do is mostly on the lines of exercise prescription and exercise physiology. So I teach a lot on strength training principles as they apply to rehab, and some of the basics around some of the therapeutic exercise, and that's where a lot of my research is as well. And most recently, I've gotten into looking at markers of recovery from exercise, as well as mental health and stress markers like heart rate variability, looking at CO2 levels to look at if someone's breathing appropriately or over breathing, and looking at the mindful aspect of recovery from either exercise or multiple other things. So, yes, where I'm from Saskatoon. This is, of course, where the university is. I was pretty much born and raised. I've moved around, did my PhD in Edmonton, but my master's, it was a master's of science, and I was one of these dinosaur people that graduated with a bachelor's of physical therapy. So I have a bachelor's of science, and so I got that here at the U of S as well, at the University of Saskatchewan. So I spent most of my life here in Saskatoon, so that's so I did most of my schooling here, except for the PhD, which was in Edmonton, University of Alberta. So I think I already said my fun fact, but I think you guys are going to ask about my Star Wars roots, and of course I don't know if I don't know if this is a video podcast or but anyway, I've got my Star Wars Hawaiian shirt on. If you can see that, there's Chewie and R2 and BB-8 and C-3PO and all that. So anyway, that's my fun fact. Big Star Wars nerd.
Nice. I don't know if you remember this, but when I hosted you for Physio Night Out, which is this free talking thing that I had sort of this TED talk. We were walking back from the parking lot, and you were telling me something like some sort of Star Wars reference, and you asked me if I watched Star Wars. I'm like, oh, I used to watch it when I was a kid, but the way it came out as if I was saying like, oh, that's a kiddie thing, but that's not what I meant. I meant it just like, oh, I don't watch it anymore, but I did like Star Wars at one time. But yeah,
Yeah. So
definitely.
So you've been thinking about that ever since. So that's got to be 6 years, 5, 6 years. You've been thinking about that. It's been on your mind, worrying that
Yeah, yeah,
you
yeah.
you dissed me this whole time.
It wasn't meant to be a diss. It wasn't meant to be a diss. I was just responding with the facts.
All good. Yeah, all good.
I love it.
Never.
So, as you mentioned earlier, Scotty, we've connected on social media a number of times in the past. So, I've always known you as at the Strength Jedi. So dive a little bit deeper into why you came up with that handle and why you go with that now.
Well, you can look at it from a very simplistic perspective, and I love strength training, and I love the concept of a Jedi through Star Wars. You put them together, and that's what you get. That's the simplistic answer, and ultimately that's probably why I came up with it. But if we want to dive a bit deeper into that, I don't want to waste too much time. But what I will tell you is that my concepts around what I really believe the force, and this is going to really geek out for those that haven't had any exposure to Star Wars. Like, you're going to be like, what the hell is this guy talking about? Anyway, the force is sort of it's like the chi, or the energy that binds us all, and I really resonate with that when I look at the concepts around mindfulness and interoception that comes with the biofeedback work that I'm doing, and understanding the feelings around the body. And so I think there's a very strong connection there. Also, one of my mantras, I suppose, is a quote by Saint Francis de Sales, which says, "Nothing is so strong as gentleness. Nothing so gentle as real strength." And so for me, that encompasses the balance, which is again another Star Wars thing, a balance between what you think of from a strength perspective, which is sort of aggressive, but really saying that it's not. It's also about gentleness, and then the Jedi being around the Force, and so it's the combination. It's the yin yang, basically, if you want to look at it in those terms. So, yeah, that's the deep story.
Nice. So how about you take us to the pre-Strength Jedi days? What got you into physiotherapy? Tell us a little bit about your journey of becoming a physiotherapist and then a professor of physiotherapy.
So yeah, thanks for the question. So like many people getting into physio, I was an athlete and was treated by a physio, and so that was my exposure to the profession. I went back to, geez, I want to say grade seven, where I was in gymnastics, and one of the legends of physiotherapy here in Saskatoon was one of the ones that treated me, Richard Barassa. He's fairly big in the manual therapy world across Canada, but treated me, and I was very intrigued by the profession. And so as I started getting into it and learning more and going through high school, and I was pretty convinced that that's what I wanted to do. Started to volunteer with teams to try and shadow the physical therapists that worked in sports. And so I went through my university career, which was really trying to get into physio. Started in kinesiology, thinking I'm going to go into sports physios. And that's what led me into it. Once I got into physio, I again sort of fell into I want to do sports physio, and really pursued a lot of the things that I would need to do, volunteering with sports, going into the athletic therapy program that we have here at the University of Saskatchewan, where you can be one of the therapists for one of the university teams. Did all of that kind of thing. Got out of physio school, worked in sports medicine for about a year and a half, and then left it. I went from there into some grad school, and in sort of sports science, and then went into got the good fortune, I'll say, of deciding to not stay in sports and orthopedics, and then I went into pulmonary rehab, working with individuals with COPD, and then that's what took me through my PhD, and in exercise physiology and respiratory physiology and strength and conditioning, all kind of meshed together. And that's what I started to do as a professor. So I got a job here back at my alma mater, hometown. Lucky enough to do that without getting a postdoc. which is fairly rare these days. Most people coming out of a PhD to get a faculty position usually take a postdoctorate fellowship of some sort. But yeah, I got my job here at the University of Saskatchewan as a professor, and yeah, I guess the rest is history. Started working in the pulmonary rehab research, and led me to the idea that when you're limited by your lungs, and your lungs aren't going to get any better, like someone with COPD, that's a permanent lung disease, that you have to start thinking about how to train the body in other ways. And that's what really led me to the concept of looking at muscular limitations and strength training as an adjunct to the typical rehab, and then potentially a replacement to the typical rehab that you'd see with a lot of individuals. So got me into the strength training world, and then everything progressed from there.
Nice, very cool.
I just had a question branching off of that. So when you were doing all your grad school work and research work, when you were trying to make that shift, were you also working concurrently as a physiotherapist still on the side?
When I was doing my master's, yes, I did my master's here at the U of S, and I was working clinically as a physio in orthopedics at the time. It's not a ghost, it's my cat. There's her tail. Anyways, walking by. Um, yeah, I was in orthopedics in a private practice, and just part time. But that was a tough situation. With my PhD, I was lucky enough to have a stipend that was a separate research project. So it was still in the research realm, but I was working, but not as a physio at that time.
Gotcha. Yeah, no, it's good to know, just because some of the people that I've had conversations with in terms of wanting to make that jump from practitioner to get into academia, they always wonder if they, just go full throttle with the grad school and, master's, PhD, and then right into it, or if they can kind of work on the side as well, so that's definitely good to know. Um,
It's a good question. If I can just
yeah,
put a bow on that one. The whole idea of working while you're doing grad school can be super beneficial if you're doing research in the area that you're working, which I wasn't when I was doing my master's. It was a completely different population, completely different work scenario. But I know a lot of people that work clinically and are have tied their research project into a lot of the clinical work that they do. Then it becomes a really seamless scenario where you can work as a physio and do research. To do it separately is much more difficult.
gotcha. No, that's good to know for sure. Um, Moving on to, speaking about U of S specifically. So you're obviously in the U of S faculty. We tend to think that you know a thing or two about the program. So would you be able to maybe give us a brief overview of the PT program at U of S, maybe how the semesters are organized, when the placements are, number of placements, and just the general length of the program?
Yeah, for sure. So we get students admitted in the fall. Right now, we're in the process of program change. Actually, we're doing a significant revision to our program right now, and this incoming cohort coming up this fall will be the last cohort that will take the full stream of the old program, and then everything beyond that, from what I understand, is going to be a bit of a new stream. Having said that, things aren't going to change that much in terms of the structure. We get started right now. It's about the third week in August, and in the future it'll be, I think, the first week in September. So it's just a couple weeks of difference. We start off with one big long module from September to December, and this is the foundations module, where we have a lot of courses that have been sort of amalgamated together to give one big foundations concept. So you take your anatomy, some basic therapeutic treatment methods and assessment methods, and neuroanatomy, and those sort of things in this first module. So that when they first come in August or September, they have the odd little bit of clinical experience. You get a day here and there, just so everybody kind of knows what the profession's about, at least in Saskatoon. Um, so then from there, so that's module one. So we have that as a big module. We have module two, which is another big module. That one goes from January of the first year up until May, and that's another mishmash of foundations courses, but they're a bit more applied. So you would take some of the initial theoretical information that you get from some of the basic sciences, and now you're looking at actual assessment methods in different types of populations. You're looking at range of motion, manual muscle testing, basic therapeutic exercise, lots of communication skills, some of the modalities that you would do, the therapeutic agents that you would see, as well as some of the basic techniques like crutch walking and things like that. And so that's really your first year. And then at the end of the first year, we give them a one placement, which is it's sometimes 4, sometimes 5 weeks. Then get a bit of a summer break. We get about a month off, which is fairly compressed. It's unfortunate that we don't have a longer break, but at the same time, then you get it done faster. So there's obviously pros and cons there. We have a second year, which in that second year, there are much more applied courses. So this is where you learn a lot more about a lot of what we call indicator conditions, of course, which are the conditions that everybody that graduates from a physiotherapy program needs to know, and then talking about some of the ones that are the nice to know, and looking at some of the main examples of the types of conditions that you're going to treat, as well as the basic assessment and treatment methods that go along with those conditions. And so that really forms the bulk of the September to December of that second year, where you're really going into a lot of applied material. Then after that, we have a big long chunk of placements where students will go into 4 separate placements that are between 4 and 5 weeks long. And then they come back for one final module at the end. So all in all, it's 26 weeks, so just over 2 years of the program. And as you can tell, the modules themselves are of varying length. They don't follow the university term. They're not always the 4 months, in three terms or across the 4 months or 3 trimesters. It's we have again those big long ones, and then the ones in the beginning of the second year, they're actually 2 separate modules of 6 weeks of length each. So there's lots of variability there. Pros and cons to both. Some the 6 week ones go by really fast, and you got to learn a lot of material very quickly. And the longer ones are, as you would think, long and drawn out, but you get more opportunity to learn and digest some of the information, but you got to remember it over a longer period of time.
And what separates U of S from other physiotherapy schools? What's U of S well known for?
So I'm not well versed in all of the physiotherapy schools across Canada, so I don't want to do a direct comparison per se. But our students are known to be very empathetic, good communicators, strong on their manual therapy and orthopedic skills, and if I can be somewhat biased, come out with knowledge of strength and conditioning, which is fairly unique across Canada.
Yeah, we see a lot of the Instagram stories that students post during classes, and they're doing a lot of strength training, rehab type work in their labs. And I got to say, we're a bit envious of that because that's something that we never got in our training. But I know U of S does do that, thanks to you in part. And you mentioned right now that a lot of the students that come into the program are very empathetic, great communication skills. Is that something that they have and that students have because of the admission process, you think? Or do you think that's something that they develop through the program, or a bit of
A
both?
great question. Yeah, it's a great question. I mean, it's probably a bit of both. I mean, I don't think you can uh, just accept anybody into the program and make everybody into a very empathetic clinician. I think there's a certain amount of screening process that happens with the admissions process. But I do think that our program, because we place so much of an emphasis on communication. Um, there's 4 separate courses on professional practice where the biggest part of what they're doing is developing communication skills, and we weave that into the clinical decision making process as part of the other siloed courses, so the musculoskeletal, neuro, and cardiorespiratory, as well as the critical thinking courses. So we do place a really strong emphasis on communication and understanding the relevance and importance of empathy. So I do think we do, and that's done intentionally. So I think that's the fact that we're known to some degree because of that. I think it's because of the way that we approach it. But you can't, like I said, say that the admissions process has nothing to do with it at all. I think it definitely does.
For
And is
sure.
that something that you've included into the program over the years, or has U of S been incorporating, courses that have an emphasis on communication skills and on professional responsibilities and learning a little bit about narratives of different people who go through different conditions? Is that something that got incorporated over the years? Has the program transformed to sort of focus on that, or is that something that the faculty has been incorporating into their classes for a really long time now?
Great question. So we certainly been doing it for a long time, and there's been more pockets of that happening. I think in recent years there has been a transition where we've really tried to emphasize it more, recognizing the importance of communication and empathizing with your client because I know this goes a little bit beyond what you were actually asking, but the rationale for doing that is because we know the importance of beliefs, expectations, and goals. And if you can really connect with your client or your patient and really understand the beliefs, expectations, and goals through an empathetic process, that your skills in therapy, like your manual skills or even your exercise prescription skills, all of these other things, they matter so much less when you can really empathize with your client and connect with them to get at what they really believe in. So this has been done intentionally, and I think this is one of the things that a lot of students don't really recognize or know about, or haven't had exposure to, that we do as faculty, although we're following a set curriculum that is based on our accreditation process. There's certain things we have to do. We also have enough flexibility to go, well, this thing that I have to do is worth that much, and this thing that I have to do is worth a whole bunch more, and make some adjustments there as we go. And so we certainly recognize the importance of the communication piece over time and built that up intentionally. But I think just knowing the players that have been involved here for the length of time that they have, it's always been a focus of a number of them. So I'd say it's a bit of both, Cash.
Gotcha. Well, it's good to know.
I was wondering, just on the topic of communication. So, do you find for the newer physio students, it's kind of a tough sell at first because you come into physio school, you're just like eager to get your hands on people, learn the manual skills, give me the exercises, give me that whole catalog. I want to be a body mechanic type thing, and then you're just like, hey, look, you got to empathize with your patients, right? Like I understand that as a practicing physio, and I understand how important that is, but as those newer physio students, like you mentioned, maybe they didn't have that exposure. So do you find that there's any struggles with that at the outset?
Oh, totally. Absolutely. 100%. The thing is, like, we always talk about how each cohort of students coming through has a personality of their own, right? Some cohorts are more outgoing, some are very questioning, some are, but everybody is so individual. I mean, we categorize them as such, but you're going to get a certain number of individuals coming into the program that are just empathetic by nature, and they pick it up really easily. Having said that, you are absolutely right. There is a significant number of students, and I would say not only just the new students, some of the students that have gone through that are nearing the end of their second year, I do find that the message, if it's being taken as a message of, oh, you have to do it like this, it's an old message to them that I think kind of falls on some deaf ears sometimes. I say that with love because I fully understand that when I was going through my physio school, I was one of those guys that was like, yeah, holistic care, biopsychosocial model, sure, sure, sure. Now teach me my manual therapy and teach me my exercises and let's get going. I was one of those hard sells, but it took me a long time to break out of that, even past being in school. And I'll fully admit that. But I do recognize the value of it now and the importance of it now, and it's partially because spending time in the profession, but also looking at what the research does. But Yes, there are a certain number of individuals that come through that end up being great clinicians in the end, and it's no slight to them. It's just a different style of personality. Yeah, a lot of them want the not necessarily the cookie cutter, but they want the hard skills, and the soft skills are not the way they were raised. Let's just put it that way.
Yeah, yeah, it doesn't surprise me at all. But like you said, you get your feet wet in practice, and then I think you start to realize a little bit more about how much more important that actually is to hone in on.
Well, I think you get into practice, and at some point in time, whether it's during your clinical placements while you're in school, or at some point in time when you're out in practice, and you start to realize that when you're focusing only on the hard skills, your outcomes are not good.
Yeah,
And I say again, I say that with love for the profession and for people that are really trying to hone their skills, is that you go through the process of going, mechanistically, I see this problem, so I'm going to correct it with this solution that is a direct link that I can make, mechanistically. Um, and then you start to realize, well, okay, I did all the right things, but they're not getting better, right? Or they're not responding the way that I would want them to respond. And yeah, you get your feet wet, and sometimes it's a bit of a culture shock. It's you kind of get into it, and you go, whoa, do some self reflection and say, what am I doing? What am I missing here? And if you listen to good mentors, if you have good mentors and listen to good mentors, often the missing piece is your ability to connect with clients. It's not, for some people, it's not inherent. It's not something that is. It is definitely something that is teachable, and is not something that people have had exposure to. So sometimes it takes a while to learn them. It took a while for me to learn it. And
yeah,
I'm speaking with love because I was one of those guys.
yeah. Cash, you and I have had many conversations about this too in the past as well.
Oh, for sure. And Scott, you've been a physio for longer than we have. Have you seen a shift in the profession going from more of this, I guess, pathoanatomical model, this hard science and anatomy, biology model, to more of this biopsychosocial model? And how has that been received by some of the physiotherapists that were around since you were around, or who were your professors at one time? Have they been able to make this adjustment? Have they been able to, I guess, accept this new model of medicine that's starting to get integrated into the profession and other medical fields?
Oh, it's such an interesting question. Um, what I want to say is 100% yes, but that's not true. Um,
You don't need to name
I,
names.
no, 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 I won't be naming any names. I get myself in enough trouble just being, point blank honest on a lot of things. No, I won't name names, but I, certainly the profession as a whole, yes, I've seen a big shift that the profession as a whole has really moved from the pathoanatomical model, the mechanistic model, into biopsychosocial. And the biggest shift has been, it's not that we haven't talked about treating the whole person ever since even when I was in physio school, which was 26 years ago. And it was talked about back then, but we didn't know what to do with it, right? We talked about how important it was, but we didn't know what to do. We didn't have the abilities to say, okay, well, here's what you actually have to do. We would just rely then back on, oh, okay, well, we'll treat the whole person. Yeah, yeah, yeah. We're going to ask about their psychosocial status. Yeah, yeah, yeah. Now let me treat you with my hands. And that's how it went for many many situations. I think that there are people that, and I'm going to say this is true of likely any profession, healthcare or otherwise, that you're going to get people that just they do what they do, and they get stuck in their ways. And I won't name names, and I won't put any labels on them. Although you'll hear a lot on social media, especially if you're talking to a guy like Adam Meekins from the UK, who's very very outspoken. If you don't know who he is, and he has a particular terminology that he calls individuals that are stuck in their ways. It's not about age. It's about being stuck or not. But so there are those individuals that aren't going to change, or the change is much slower. And then there's those that really embrace it, and are looking for the latest courses to teach them how to incorporate that style of care into what they're doing, and to know that yes, my hands are still valuable, but my heart and my voice and my ears are just as or even more valuable. But then how do you put all that together? And how do you actually, when you have someone in front of you, how do you actually take the knowledge that you have and turn it into more than just a therapy, like a talk therapy session, right? So I mean, that is honestly, that's the criticism that I hear from individuals that don't move in the direction of really understanding the psychosocial model, is that they're not therapists, they're not talk therapists, right? So they don't understand the value, or aren't willing to go down the path of learning the value of incorporating that. But as you say, the to connect with a client and to understand the importance of getting at their beliefs, expectations, goals, and the emotions aside, that are really inherent as part of that, to take that and marry it to all of this other knowledge that you have in terms of trying to treat someone, and all the skills that you've got, and all the modalities you use, and all the techniques that you've learned. It's a hard thing to try and figure out how to put that all together. And so it's, people are going to take that in varying ways. Some people are going to embrace it, and some are going to push back. I think that's just the nature of it. But as a whole, yes, as a whole, our profession is moving that way, and it's partially because we're starting to teach that more in school, but also that our continuing education is also pushing down that line as well.
So you mentioned that one of the pushbacks against it is that people don't just want to do talk therapy. And another thing that you mentioned was that people don't know what to do with that information. When you learned it in physio school, you learned that there was such a thing as biopsychosocial approach. But so what? What do we do with that information? So how can physiotherapists implement the biopsychosocial approach, the other side of it, the psychosocial sides of it, um, within our scope of practice? Because what we're taught in school doesn't emphasize this maybe as much as the bio aspect of it. So we're not trained in the same way that a psychotherapist or a psychologist might be. So what can a physio do to incorporate the psychosocial aspect of therapy?
Yeah, awesome. Yeah, and there's no, what you're going to see right away, there's no black and white answer on this one, because if humans were straightforward black and white, then the biomechanical pathoanatomical model would work, but it doesn't. So there's no golden ticket answer, to how this works. The biggest thing is, yes, you learn your skills, right? And you learn the hard skills, you learn your techniques, you learn all of that stuff. But when it comes down to it, it's a matter of recognizing again that the client that's in front of you comes with so many different histories and experiences and cultural aspects, social aspects, emotional concerns, or just approaches, how they were raised, any micro trauma or even major traumas that have impacted the way that they experience life. If you can recognize that everyone is going to come to you differently, then an ankle sprain doesn't sound like an ankle sprain anymore. It sounds like, oh, I've got this person in front of me with this massive history that's going to impact not only what they're feeling, but what they're capable of doing. So, and what they want and what they believe. Some people are going to, really thrive in a situation where you manage their stress. Now, talking about scope of practice, well, we aren't mental therapists, we aren't psychotherapists, we aren't counselors, we aren't psychologists. So we can't diagnose these concerns from a psychological, emotional, social perspective. We're not trained to do that. We're also not trained to directly say that my treatment is targeted for those things. Okay, so that's part of where the scope of practice issue comes in. But what we can say is that the way that I'm talking with my individual here is informed by all of these experiences that they bring to you, and that they bring to the table, and that those experiences are going to have an impact on where we go with things, and what they're going to do, and what they're going to want to do. And that's why at the beginning of this podcast, I really emphasize the concept of beliefs, expectations, and goals. Because if you can understand the person and really get a sense of the beliefs, expectations, and goals for them, then the question about, well, what's better is an isolated quads exercise better than a squat or whatever, it almost becomes mute. It's almost a moot point that we just don't care. It doesn't matter, because what does the client believe is going to help them? Now, are squats and knee extensions both going to strengthen the quads? Totally, right? You could argue one is better than the other in some way, shape, or form, and I could have this argument for like 5 hours with someone about the pros and cons of both. But at the end of the day, none of that matters if you're not working with the client from that biopsychosocial perspective, particularly the psychological and the social side of things, to understand, is that even something that they're going to do? Do they even resonate with the fact of why you would want to do that? Right? Because if they're not, then they're A, not going to do it, or B, they're going to do it and they're going to hate it, and they're not going to put the dedicated attention that's needed into achieving the goals that you want. So for a knee injury, and you're thinking you're arguing squats and leg extensions, they may be telling you, based on whatever part of their history, their cultural aspects, social aspects, psychological aspects, that really they just need to go for a walk, right? And you may be thinking, that's not targeting the knee the way I want it to, but that might be what they need. And if that is what they need because of the beliefs, expectations, and goals, that's where your outcomes are going to be enhanced. So it's it's not so much about trying to target those things. It's about being a good listener to understand that this is a human in front of you that you have some expertise on, but they are the experts on themselves. And as soon as you start saying that they are the experts on what they can do and what they think is going to help them and what is going to make the big difference for them from an expectation perspective, then you can help guide them and turn it into a coaching relationship rather than a fixer and an injured person per se. So it's about transforming your practice from being a fixer to a coach, I think, is really what I'm trying to say.
And do you think that these cohorts of students who have gone through the program with the implementation of this approach to treating a person are much better, not only equipped, because obviously they've been taught, but are able to implement this into their practice a lot easier than students in the past, taking more of this patient-centered approach that you're describing? Do you see the newer generation able to translate this into practice a lot easier than older physios who have learned this after they've been practicing a certain way for a while? Or is it easy to be able to incorporate that into your practice once you've been practicing a certain way for a while?
I think there's some variability in what you're going to see here. Again, I'd love to say absolutely they're going to be better.
But
Or
what
it
you've
be,
seen over the years, because you've had
yeah,
so many cohorts go through your program, you've seen so many physios come through who are now working as physiotherapists, so many students who are now physios. Have you seen this change since some of this stuff has been incorporated into the programs?
yeah. Thanks for taking me out of my wishy-washy answer
Yeah.
into something more direct. Cash, I can always count on you for that. Which is awesome. No, it's yeah. So short answer, yes. Yeah, short answer is yes. The problem, and again, I'm going to qualify my answer with just saying the problem is that we're very infrequently coming out of physio school and working in a silo where you're by yourself and you have to figure this all out. I think those that are in those scenarios come out with a better handle on things for sure. Um, I think there's some individuals, some physios that would, depending on where they end up doing their placements, their clinical placements, but also then their initial work environment, like that initial work environment sets the stage for their career in a very profound, powerful way, because you're forming the habits that you're taking your knowledge and you're doing it on a day-to-day basis, and you're forming the habits that are going to keep with you for the rest of your career. Now, those habits could be proactive, or they could be based on what your employer is basically saying is their model of practice. And let's face it, it's a lot about, if you go into a clinic that's primarily known for their hard manual therapy skills and not so much on the other skills, you're going to have a bias in terms of the way that you approach things. So I think our initial practice areas can influence and change
Mhm.
our beliefs and the way that we approach things in either way. So I think as a whole, students are more open to it because they are more exposed to that. Whether it solidifies or not, I think really depends on the people that they have around them as they're graduating.
Gotcha. Yeah, makes total sense. I think that your job definitely and your mentors that you get outside of physio school end up having a huge influence on the way you end up practicing further along in your career.
No.
100%.
And you develop those habits, and whether they become positive or negative or however you want to phrase it, you can always change, right? And that's the sign, I think, of a good seasoned clinician, is someone that's willing to reflect on their practice and say, yeah, you know what I said about this issue 5 years ago or 4 years ago or 10 years ago or whatever, I don't believe that anymore. And I, you could pick a hundred different things that I used to say even 5 to 10 years ago. And that's less than half of my current practice, the time that I've been a physio. And you could take 100 things and I'd be, oh yeah, no, I say something different in all of these. I think it's just a mark of a good clinician and someone who's willing to change their minds and their practice based on upcoming evidence, based on new experiences, and not get stuck in the rut. I think those are the ones that are the most successful. I think they're also the ones that stick with the profession.
Mhm.
Let's face it, we have a really strong attrition rate, or a very high attrition rate, unfortunately. They stick with the profession and they don't burn out as much. They have a sense of purpose that stays if you can adapt to the times.
I wholeheartedly agree. And like, I have a sample size of less than 4 years in practice, but I feel like I've done the same thing that you were saying, where I've just, the things that I said in my first year of practice, like some of them I don't even say now, but I feel like as frustrating as it can be sometimes to change those beliefs and change the way that you practice, I feel like that's what's kept me continuing to go and grow in the profession. I feel like when I've stayed stagnant, that's when I've been like, oh, okay, we gotta change things up here. We gotta learn something new and see how we can get better. So it makes me encouraged to know that a mind like you is in a faculty in the Canadian physiotherapy program, and really trying to change things from the top down. So it's awesome.
I think you're going to find that most people, most faculty are, well, don't want to get myself in too much trouble. There's a lot of faculty that you would find are exactly the same.
Yeah, no, it's good
It's
to
just,
hear.
yeah.
I'm sure you guys would agree. I'm loving this discussion right now. I feel like I could go on for forever about it, but I just wanted to take a hard left just back to the actual, like, the U of S program. I'm not sure how much insight you have into this, Scotty, but I know most of the people within the U of S program, they're from Saskatchewan. There are some seats for Yukon, Northwest Territories, and Nunavut. Approximately, if you know how many people from outside of the province are admitted to the program each year.
We don't have a hard number on it, and it's actually, we don't have external seats. We consider those in the Northwest Territories, Yukon, and Nunavut being considered residents. If just simply because there's so few individuals from there, and it's harder to get in. So we have equity seats for the biggest population that minority population that we have in Saskatchewan. In our in our indigenous population, we have a certain number of equity seats. I think it's at 8 right now out of our, well, we just increased our numbers to 55, from 40 to 55 this incoming cohort. um, but I think there's 8 seats for the equity, and then coming out from outside of actually Saskatchewan, if you're from another province that isn't up in the north, then you have to have some tie to Saskatchewan to be considered a resident. So we still have a residency requirement that's being reviewed right now, though. So I don't know if in a year or two's time that'll remain. But that residence requirement means that you have to have some ties to Saskatchewan, whether it be a parent who lives there or graduated from a Saskatchewan university, or you've spent 2 years in Saskatchewan, with a Saskatchewan resident. And there's a few other criteria that I don't have at the top of my head. But in terms of numbers of people from the north, I don't have those stats. Usually, from just the students that I've interacted with, I think there's a small handful, maybe 3 or 4 that would come from there, and then our 8 equity seats, and then anybody that comes from another province, as I said, has some tie somewhere to Saskatchewan at present. But I don't know those numbers offhand.
Yeah, I think as well, if you went to U of S as well, if you're out of province, if you went to U of S, you can then apply to the program. Is that correct?
I believe so. Yes.
Yeah.
Okay.
And of the students from Saskatchewan that you know previously are from Saskatchewan, do you find that when they enter the program, a lot of them already knew each other from before? Because when we were going into physio school in Ontario, just because they're literally coming from everywhere, right? We're getting the Maritimes, we're getting the Prairies, we're getting people from here out west in BC. I knew like a couple people when I was going into my physio program, but the vast majority I didn't know. So is it different that you find in the U of S program?
Yeah, we get because we have a very big kinesiology program here at the U of S. I'd say on a typical year we would get 50% of our admitted students that come from the U of S kinesiology program. So there's a huge number that actually know each other fairly intimately, and some that are really good friends that have gone through all of university together. You get a lot of that. But then, of course, you also have individuals that are coming from other places too. But it's interesting because you do get this strong sort of micro cohort within each cohort that is really well known to each other. And it's you're not asking this question, but I'm going to answer it anyway. It can be positive, but it can also be detrimental too, because sometimes the diversity that we want in our profession is it's tough to find when you have such a big cohort of individuals that know each other that well.
I could definitely see that.
Okay. So I'd be remiss if I didn't ask for our listeners some tips for applications for anyone who wants to apply to U of S. Do you have any general tips for anyone who's applying to U of S? Any insights on what the admission team is looking for in terms of characteristics or experiences for students to have prior to applying?
I do have some insights, although I was the chair of our admissions committee. I want to say it's about 6 or 7 years ago, and that was prior to Casper. So I'm actually not that familiar in terms of the Casper and everything along those lines. But certainly, being able to do well on that, as well as having a relatively high admission average. I mean, that's really what we calculated on. But I mean, in order to do well and to be successful in the admissions process, particularly with I believe there's an essay that comes along with that um, understanding the profession is really important. And I think that the more you can expose yourself to different areas of the profession, that's only going to help you in the way that you frame your answers to a lot of the questions that end up being asked. So, um, I mean, admission average, obviously, that's something that's super important. You need to. I think it's currently 60% of the admission score is set at of the academic average GPA coming in. But then the rest of it is around just really having a good knowledge of the healthcare scenarios and situations, and being able to think clearly, and even practicing getting your thoughts together on how you would perceive different issues in healthcare. So exposure to the profession, and making sure you get some time to get your grades up, and also live a well-rounded life too. Not that that's really looked at, but I'm always concerned for students' mental health, and their overall wellness. And let's face it, trying to get into physio school is not without its stressors, and you have to take care of yourself too. So don't burn yourself out just before you even get in.
So
Absolutely.
in preparation for applying, are there specific experiences that are fondly looked at from the admissions teams if they were to see someone has a specific type of experience?
Well, I think knowledge of the profession, experiences within the profession, a fairly wide range is good. Although you don't want to do too much, because if you do too much, then it's seen to, that, oh well, they volunteered in 15 different places, and five of them were, private practice. There could be a negative viewpoint that, well, because it takes clinician time to shadow, or to have someone shadow you. And so it sometimes, if you do too much, could be looked upon as, well, you did too much, and you contributed to the time constraints that a clinician would have. So if you've been to one private practice, you probably don't need to shadow anyone in another private practice. Spend some time in private, spend some time in public, and see what else is kind of out there, and maybe do a bit of volunteer work. That's usually what I think we would see to be kind of a good, well-rounded applicant would have that level of experience. It's not 15 in multiple areas.
That's interesting that you said too much is maybe detrimental because I
I
never
have
really
heard
thought of
that.
it that way.
Yeah, I've heard that being, more than once in my time with the admissions committee, and after my time with the admissions committee. That's something that's been said. So it's something that people are talking about.
So too much, as in too much in where you're getting a lot of your experience in one area of practice, or is it more of a factor of it's looked at as if you are playing a game to try to get into physio school?
Well, that's a good question. I've never heard it in terms of the game aspect. I've never heard it framed that way. Um,
Like you're
I know.
gamifying the admission
Yep.
process is what I mean.
Yeah. No, I totally know. Um, I haven't heard that when it comes to experiences. It's mostly been about, if you've been, like I said, if you've been to one private practice. I mean, yes, different private practices are different, but if you're taking up the time and the energy for a clinician who's in that private practice, again, to have someone shadow you, that takes some time, it takes some effort, and it can be looked upon by those in the community as a negative thing if you're doing too much of that. And I think it's more just the volunteerism, or the shadowing and getting some experience in a similar situation across multiple clinics, let's say. It's like, well, get a little bit in the private, get a little bit in the public, get some other maybe research experience, things along those lines, and that in and of itself is well rounded. Don't spend 5 in private and go see all the hospitals in the city, and spend time with the physios there. Not that you can't do that if you're really doing it from a genuine perspective, but the impression, again, that I've heard is that too much of that could be factored in negatively. Having said that, um, if you're going to err on one side or the other, I would err on the side of doing too much rather than the side of not doing enough.
Okay,
Yeah.
gotcha. But if it's
Yeah.
in different areas of practice, let's say you're doing private practice, but you're doing, neuro private practice, you're doing uh, obviously orthopedics, and you're doing pediatrics. Is that seen in a different light then? Because it's still taking clinicians' time, but you're exploring different areas of the profession, which is something that I think that would be beneficial to making your decision on whether this is truly something that you want to pursue or not, right?
Yeah, and I'm speaking a bit in secondhand information, so I don't want to go too strong on this point. I do think, I mean, if it were me sitting on the committee and you had that in your portfolio, and it made sense that it wasn't 3 orthopedic focused clinics. They had different focuses to them. I think that would make sense. And in Saskatchewan, our physio community is quite a bit smaller than what you'd see in a province like Ontario, where you might not know all of the clinics in Ontario as who's doing what or whatever, but certainly in Saskatchewan, we have a pretty good handle on who's out there and who's doing what. So we're small enough that you see the name of the clinic and you pretty much know what they're about. So I think something like that, at least here, you could take that into consideration, or at least I would.
Gotcha.
Yeah, no, I agree with that wholeheartedly, and that's exactly what we preach too, right? Like sometimes when you're just stacking up the resume, it's like you're padding your stats, right? And sometimes it can come off as like a little bit disingenuous if you're just doing maybe like 20 hours here, 20 hours there, 20 hours here, and it's just like all over the place, right? We always tell people, of course, have it well rounded. Get some work and volunteer experience under your belt, but of course, obviously, make sure it's something that you like as well, because it's just going to come off as more natural. It's going to show that you're passionate about it, and you're actually trying to contribute to the experiences that you're engaging in.
Yeah, totally. And I mean, this is a bit of an outdated example because we don't do the MMIs anymore. But by the end of when we were doing MMIs, I was a examiner for those for a number of years, and it would annoy all of us when you get people that have taken MMI prep courses, and you can tell that they have a structure of the way that they answer their questions, and it's like cookie cutter. Like you see applicant after applicant after applicant answering the questions in exactly the same format. I mean, the answers themselves are different, but it's like, the preliminary phrasing and the, well, I'm going to take two sides to this, and just the way that they say it is it's obvious that it feels gamified, right? I'm not sure with the way things are now if that ever comes across, but if there's an opportunity, and if you've taken a prep course, just make it your own. You don't use cookie cutter language. You take the format, cool, but maybe think about how that is you, not the way that you've been taught it per se, if that makes sense. So I know this is one of the things that you guys are doing and trying to help people get into physio schools, and I absolutely commend you guys for doing that. I would just encourage your listeners to take whatever information you're hearing from anybody and make it your own, rather than trying to verbatim replicate what's being said.
Yeah, I love that, because so we actually run mock interviews for the people who do take our interview course, and that couldn't be like it's so close to the truth, basically, right? Like I found the most common feedback we were giving in our rubrics was just like, okay, don't worry about this whole like pros and cons and establishing the whole scenario, right? Just answer the question, right? Exactly how you think you would. Of course, have your framework, but I felt like 2 minutes of 5 minutes would go by sometimes. It would be like, okay, we gotta get back on track. And I found most people do well with that feedback, but you see it a lot, especially just when you're giving these frameworks out, because people just want to go in and they don't want to get blindsided by a question. So that's why sometimes they're a little bit robotic. But I love that you reiterate that.
Have you noticed a difference in the quality of students that's admitted since the Casper has been implemented? Has that done a good job in selecting the best candidates from your perspective, from someone who teaches in the program?
Yes. Now, is it different? I don't know. Is it better? Is it worse? Is it designed as a easier supplement or an easier alternative? I don't know the answer to all that. All I do know is the students coming in typically are very strong. And if that's Casper, if that's the admission average, if
Stronger
it's the
though, stronger
process.
than prior to implementing Casper?
Um, I, I always feel that the students get stronger over time, and I don't know why that is. I'm not willing to say that it's because of Casper. I certainly don't. I don't see like a MMI versus Casper cohort being hugely different. I just see the cohorts of students being smarter in many ways. And I'm not sure why that is.
Do you think it's
Maybe it
maybe
has to do
just
with
it's
Casper.
more competitive every year, more applicants,
Could
you're
be.
probably
Yeah,
getting a selection based on a wider pool, so therefore you're able to select
possibly.
better. Yeah.
Yep. Yeah,
Yeah,
possibly.
a
I
lot
don't
of
know. I just
factors.
whatever's happening is positive for the most part. I mean, there's with any sort of change, there's always negative things that come along with it. I think that, but a lot of those things I attribute more to the changes in the way society is working with different
Mhm.
technology, and and that kind of thing. And the big one of the biggest negative changes that I've seen over a really long period of time has been the roboticism about people needing to be fed information immediately. But that is a nature of our digital information right there in front of you age that's getting worse and worse and worse and worse. I think it makes it hard to be a student and really learn critically. So the students in that way are a bit more challenged lately. But I don't think that has anything to do with the admissions process. I think overall, in terms of the strength of their character, the strength of their knowledge and their abilities, and all of those things, I honestly think that there is improvements year to year to year.
Awesome. Before I move on to this next question, just wanted to just quickly go back to the personal statement. We touched on it briefly. So U of S is very brief, right? Probably the shortest of all the schools, right? From our past students, we've heard, and just even people who have messaged us on social media have said, like, how do I get across what I want to get across? And like, it's like 100 or 200 words, right? What do you have to say to those people who just maybe, they're very expressive. They want to say a lot of things. Maybe this is more of a writing style thing, but I don't know if you have any tips on just how to keep it brief but keep it effective.
Well, you're not going to get it right the first time. And I don't mean that on first time admission. That's not what I'm trying to say. What I'm trying to say is that you're not going to, like, when you first write it, you want your passions to come through, right? And then this is part of any concise writing process, that you want to have a framework, and you want to be able to have everybody know all the wonderful things about you. But at the end of the day, you have to be able to learn to pair that into what's expected of you. There's nothing worse than rambling and then not having a point. And there's nothing worse than really just trying to going over. I mean, first of all, I think you're constricted in terms of the amount that you can submit. But, like, if it says 200 words, don't submit 400. I mean, that's not going to go over well. So I think it's practice. It's what are the main things you want to say, and don't spend a lot of time with any of the fluff. Yes, you love the profession. Yes, you've done lots of things to prepare yourself. Those things you can mention, but don't spend paragraphs on them, because you don't have paragraphs to spend on them. What makes you a unique person that would make you a great physical therapist? What is unique about you, and focus on that.
Excellent insight. This is what the listeners come for. So really appreciate you laying that all out there for us. Going back to the program, I know you have like a huge hand in this. Can you maybe tell us a little bit of how you've managed to incorporate more of the strength and conditioning aspect within the U of S program? Because Cash said it earlier too. We're pretty jealous. We're pretty jealous. We see those synergy strength days, and we're like, come on, like where was this for us, right? No offense, like I love Queens and everything, but it would have been nice to just have a little bit more of that in it.
Well, well, there's lots of different aspects. I mean, this was a development over a long period of time, to be honest. And it only happened because it's what I believed in. It's the method of training that I believe in, and that I have seen, both directly and indirectly, that causes the biggest functional change in individuals. Um, and doesn't seem to be any inferior in terms of the impairments that you see. So, I mean, the difference is, like, am I going to use a bench press to improve someone's elbow strength versus doing some bicep curls and whatever, or some tricep extensions, or, I mean, it's pretty Mickey Mouse example, but um, the bench press does so much more from a total whole body functional perspective than the isolation exercises. And so you start it from day one. So it's been a process that I really truly believe in, because I've done it and I've seen it, and it's over and over and over again. So I mean, it wasn't an easy change, to be honest. In some ways, it was just, well, I'm teaching it, so I'm just going to teach it. There's a lot of that. But there were, I mean, even to get the equipment in our facility, I had to justify why we needed dumbbells that were heavier than 10 pounds, and things that just sort of like, why do we need a squat rack? And it's just to me sort of seemed like a weird way that people were picking up on things. But I mean, when you only have a certain amount of money to buy equipment, right, you got to prioritize. But for me, it's like I would way rather have the squat rack and a platform to do deadlifting than this functional pulley that goes on the wall that has weights from half a pound up to 20 pounds. When we're talking about physio students, because part of the issue is, yeah, maybe your client can't lift more than a 20-pound pulley or whatever. I mean, you could say that that's an argument, but it's not about what the client can do when you're learning how it feels. So the problem is physio students are not usually that client that can only lift 20 pounds. They're stronger than that. They need to know what near max feels like. They need to know what the client is actually going to feel when they lift 20 pounds, and that 20 pounds is near their max. When the physio students lift 20 pounds, it's nowhere near their max. They have zero clue as to how that feels. So they need to challenge themselves in the same way they're going to be asking their clients to challenge themselves. So in order to do that, you have to do the exercises and have the loads that support that and allow people to do that. And yeah, so I mean, I guess short answer is it was a long process to get everything developed, but I had good support around me, good mentors, and you mentioned Synergy Strength. One of my best friends, groomsman at my wedding, is the owner of Synergy Strength, Chad Benko. He's been massively supportive in allowing our classes to come out to his gym environment and be involved in the teaching. He's a Canadian expert. He's actually on the Canadian national coaching team for weightlifting, and huge expertise. And he's willing. I mean, if it, I pay him as part of the, because he's a guest lecturer, but he'd do it for free. If I said I don't have any money to pay you, he'd do it for free. And to have an expert like that and the facilities available like that, it just makes it a no-brainer that you want to teach the movements, the exercises, the patterns of exercise that are going to make the biggest amount of change in your clients. And it's not your yellow TheraBand for most people. It's not going to be. And so you can't stick with that.
So a lot of your research is focused on strength training in general, and some of the more recent research you've published has been surrounding strength training, HIIT training with older adults. But earlier you had mentioned that you started off your research career looking at cardiopulmonary conditions. How did that evolve into now looking more into strength training and rehab, as opposed to looking more into cardiopulmonary conditions and interventions related to cardiopulmonary specifically? So maybe you could talk a little bit about how that transition came about, how, like, what you've learned through this research project process, and how you've adopted this kind of thinking that you currently have surrounding strength training and rehab.
Yeah, great question. So, and initially, so there's sort of two reasons things have shifted. So one is, as I mentioned before, I was recognizing that especially patients like COPD or those with heart failure, severe post MI concerns, where it's very difficult to train centrally. So if you think of the heart and cardiac output as sort of central aspects of your limitation to exercise, uh, that those populations don't have a good ability to increase that central demand. So they're already near their max, right? Because they're limited because their lungs are crap, and they're not able to. I mean, I don't say that to a client or a research participant, but I mean, we'll say this on this podcast. That their lung capacity is not good, and we know that we're not going to improve that because that's a disease and age related thing that just gets worse. So you have to look at how do you train around it. And what that led me to a couple things. It led me to looking at high intensity intervals as a clinical option, but then it also led me to strength training and training the musculature, and how do you train the muscles for the biggest functional benefit. And that really was the big difference for me, where it led to strength training methodology, where we're starting to think about squats and deadlifts and presses and pulls as the most effective methodology of training, hands down, period. Because if you think of the cardiovascular training only, that type of training is not possible with individuals with a central concern. So you have to look elsewhere. So by looking elsewhere, I'm looking at the musculature, and that leads me to strength training and the effectiveness of that style of strength and conditioning versus therapeutic exercise.
Yeah, so from my understanding, based on this explanation you're giving, it seems like you have to take more of a compensatory approach for these clients because their central system, their heart, their lungs are not able to perform the tasks that uh, they want to do. If they want to perform a function, they can't optimize it based on, increasing cardiac output or, their lung function. So instead, you're trying to compensate by making movement more efficient for them. Is that correct? You're trying to make their daily tasks, their functions more efficient. So make the musculoskeletal system maybe a more efficient system to compensate for this. Is that essentially the approach that you took earlier on when you were shifting from this cardiopulmonary focus of research to more of a strength training focus of research?
Yeah, it's about efficiency, but it's also about effectiveness of training. And what's really interesting, and I didn't have a crystal ball back then, but I kind of feel like I did, because research that came out after I started thinking about the high intensity interval approach as a method of compensating and getting good quality training peripherally. Because again, if you can't train centrally, then you train peripherally, and you get good components of improvements in function. But the research that happened after that actually started showing in some training programs, some of these individuals, like comparing uh, sort of the traditional endurance training model with a good quality high intensity intervals in patients with heart failure, for example. Those that train with the continuous sort of traditional model of aerobic training, they don't improve their cardiac output, even though they're training at kind of like the highest cardiac output that they can, or that at least that they can sustain, which you'd think would be a good training stimulus. But it turns out it's too much stress. Um, the risks aren't any different, but what happens is when you shift the training peripherally, is it makes the muscles more capable of bringing in oxygen or utilizing oxygen, and so you get that efficiency in the neuromuscular system, which then allows the overall response to get better. And what's super cool about this is that the high intensity interval groups in this pocket of research that I'm referring to, they actually found cardiac output going up in the high intensity interval group, not the continuous group, which again, everything that's been shown before in exercise training models in a heart failure patient was that you can't increase your cardiac output. But they were using the traditional model. You'd use a high intensity interval model, and then now all of a sudden their maximal cardiac output can increase. It's counterintuitive, but it's sort of proof of principle that there's something to looking at this peripheral style of training in those individuals. And that's been shown time and time again since then.
Don't want to geek out too much here because I know a lot of the listeners want to learn more about Physio School, but uh, I'm interested about this, and I wanted to ask you if there were any physiological reasons for this, why hit training would be more effective for cardiac output specifically.
Well, I mean, partially, I think what one of the problems is the way that we measure maximum performance in these really sick individuals, the individuals with high limitations cardiopulmonary wise, is that, like, let's say, I mean, the more traditional way of doing this, of measuring aerobic capacity, or technically more correct aerobic power, is your VO2 max test. So you do a maximal progressive test, from doing nothing up to, doing something really heavy for a total of a 10-minute increment. And so your traditional sort of VO2 max style of training. The problem is that we make an assumption that their body's ability to reach that maximum aerobic performance, or that maximum uh, volume of oxygen consumption, or the rate of oxygen consumption, is is limited to the same degree as someone who doesn't have those concerns. But I think what we end up seeing is we see that, yes, there's say a cardiopulmonary limitation, but we're never really pushing them to the point where their muscles can also be challenged to a high level. So I don't think we're actually reaching a true maximum with those individuals. It's more of a VO2 peak, you could say, which is sort of the difference between max and peak being like, is it truly a maximal or is it just a max that they could get to? And so I kind of look at it as most often we measure that as the max that they can get to. And then when we train them peripherally, it just means that they can then reach a higher level. Now, it's not purely only that. It's not purely only that you train the periphery and that allows you to reach a higher level of exercise performance. But we also do see, like I said, this increasing cardiac output that'll happen. The aerobic enzymes will increase significantly. Capillarization, the muscles will increase significantly. All of these things that we don't see as challenged with the traditional model of endurance training then become challenged with high intensity intervals. And coincidentally, high intensity strength training will also do something very similar as that in those individuals, and you'll see those changes across multiple body systems with that. So I think it's a matter of just being able to reach a higher maximum, but you also do get a better training effect.
Okay, gotcha. Very interesting stuff. All things that you could learn if you went to U of S for all
That is
the
correct.
listeners here.
This is the
Yeah, that's
pitch.
right.
This is the pitch right here. Yeah. So yeah,
And I
obviously,
teach you how to squat and deadlift too.
yeah, it's a
There you
win-win.
go.
You
You
can't
get
go
personal
wrong.
training too.
Yeah.
That's awesome. Yeah, no, obviously, it shows you're very passionate and knowledgeable about this stuff, and I'm sure that's going to be part of your answer for this next question, which is, what advice do you just have for those physios who are also planning on becoming a professor or going into academia or becoming a faculty member?
Yeah, you have to find your passion. I mean, you're absolutely right in saying that that's the answer or part of the answer. It's, if you are not passionate about the area that you're studying in and that you're working in, there's no way you're going to get through a PhD. It's just, I mean, a master's you could probably muddle through. PhD is a different scenario. If you do not have a passion for what you're doing, you're not going to enjoy it. You're not going to learn it as well. You're not going to teach it as well. I think that's the biggest thing. And then along with that is persistence, because there are times, absolutely, with it, I mean, even in basic being a physio in a clinic, there are times when your passion will wane, right? And it'll be like, I don't know why I'm doing what I'm doing. You're always going to have a situation where you're going to say that. And the number of times that I said that throughout doing my PhD, yeah, it was significant. So you have to have something that creates a good motivating goal for you, where you're able to return to it, and it's only going to happen if you have that area that you really believe in. But then
Yeah,
I'll say the last thing I'll say around that is once you find that, you just got to go. You just got to go for it and make it happen, even when the odds seem like they're against you. Just take a bit of a leap of faith to follow the passion.
yeah.
On that note, talking about passion, I know, Anthony, did you want to ask something
I
else?
was just gonna say, so this fruit fly is killing me right now. But anyways, no, I was just gonna say, like, I like how raw that answer is too, because I find it's easy to just go to your page, see all your credentials, all the letters beside your name, and it seems like it's like a straight linear path, but there's a lot of bumps along the road, and I feel like I hear that more in private conversations, but sometimes on like these podcasts, like some people will make it seem like it's just all roses and fairy tales, but I appreciate just how true your story is there.
Oh, why gush over it? I mean, like, physio is a great profession. I'm not going to lie, but I'm also not going to lie and say that it doesn't have its faults, right? And the path towards anything that you're going to do, it's never a straight road. It's always a bumpy road, and some roads are bumpier than others, and you just got to develop some resilience. And
Yeah. So I actually wanted to ask you a question about how you've been able to marry all your different passions together on a bunch of different projects that you do. So I'm going to try to summarize all of them. I know you have a few going and I might get some of it wrong, so you can correct me. You got the strength and conditioning in rehab online certification program, right? So that's one thing you're doing. You got Stoic Tiger, which is more of a stress and resilient coaching program. Is that correct? It's more of a
That
coaching
is
program
correct.
on that one.
Yes,
And
yes.
now, most recently, you've opened up a clinic that is sort of incorporating this and treating clients using your approach. Can you talk about all these different ventures that you're doing? Explain what it is you're doing and how you're able to manage this while also holding a faculty position, working as a professor, doing research, doing everything else. So, how do you do all this? And what is it exactly? What's your role in all these different projects that you're doing?
Yeah, great question. And I try and think about an answer to this, and it's like I don't know. I've got 5 kids in our blended family, but they're all teens now, so they're all on their Fortnite and Minecraft and YouTube and like doing all that stuff. So they're a little bit less needy, well, a lot less needy than they were when they were younger. So I feel like I have a bit more time than I did before. With kids. They also can be quite helpful too. And incidentally, with the new clinic purchase, and I mean they were great as movers. We had a ton of
Nice
stuff that we
child
had to
labor.
move, and yeah, it
Great.
was child labor, absolutely. I mean, we paid them in crumble cookies, but I don't know if you guys have crumble out where you guys are, but we paid them in cookies, and we also paid them some Starbucks money, and that helps. um, so that was a good part of it. Yeah, no, I've sort of recognized, and I think the main reason that I'm doing a lot of these things, well, the strength and conditioning in rehab is a continuing education program, certificate program, as you've mentioned, Cash, that is designed to help physios like all of us who went through school and didn't get any strength and conditioning or a significant amount of strength and conditioning background. And so the idea is that I mentor them. I have a program of studies where it's interactive. They have assignments and things like that, and that really relates to my passion in teaching people strength and conditioning. And so that's been going well. I've done, as you know, Cash, weekend courses on this for many years, over a decade. And it's just recently that I've turned that to an online virtual format. So that's something that's always going to be kind of ongoing in the background. The newer ventures, the Stoic Tiger is one that came out of some of the research that I was doing on heart rate variability, biofeedback, and breathing behavior facilitation, and carbon dioxide and tidal CO2 biofeedback, and some of the work that I've been doing in breathing, which is really cool because it brings me right back to my PhD in respiratory physiology. So it's kind of like this neat whole circle thing, but it's about recognizing that, and this you talk, Anthony, you talked about personal stories and how the ups and downs. I'm not shy to share the fact that through all of this process that I've been talking about, that I struggled with a significant amount of generalized anxiety disorder that was disabling at many times in my career. And what has helped me helped me work through it has been discovering mindfulness and the derivatives of mindfulness that include breathing practices, breathing awareness, and which then, of course, I'm trained as a physiologist. So, like, if something works, I want to know why. So I delved into this and found the concepts around heart rate variability and breathing mechanics, and looking at breathing patterns, and the whether you're over breathing or not, as some of the main drivers for where I think some of the changes are happening. So of course I had to learn all about that, applied that to my research, and then said, you know what, this is great for research, but research has protocols where I can't individualize what I'm doing to every person that I see. I know I can have an impact like the impact it had for me. So if people are out there with stressors that are through the roof, feeling anxiety, whether it's an actual disorder or just like massive overwhelming your work scenarios or your school scenarios or things like that, I thought, the type of things that helped me, I learned about, and I learned about all the research and the techniques and things like that to be able to teach people those, that I teach people those now because I know I can have an impact. And if I can help people the way that I learn, and that I was able to help myself, so that I, for example, I had some anxiety about coming onto this podcast, and I'd be lying if I said I didn't think, maybe I could just cancel, and they'd be okay. I wouldn't. That thought went through my mind, and I'm being 100% transparent and honest. But in my old situation, before I did all the work, that's what I would have done. I would have said, "Oh, I would have got too anxious to be able to come on." But because of the work that I've done, and the my ability to train my nervous system, really, it's about training your parasympathetic nervous system, and improving the drive of the vagus nerve through a very particular training program that involves biofeedback. You look at your own numbers and all these things. It's very cool and complicated and super effective. And I needed to be able to tell people my story, as well as help them through their stories. And so that's what the Stoic Tiger is about. It's an online remote program where I help people get through their stresses and anxieties, and close to burnout, um,
So
and
that
to
one
be
is
able to do
client
it in their best
facing
life.
then? Stoic Tiger is a client facing coaching program then.
It's client facing, but I target physios and other health professionals, just because it's
Gotcha.
the population that I know. But I mean, I would have other clients. So some of the physios that are in the program are client facing, or they are clients. So it's their clients, even though they're health professionals. But yeah, it is client facing. And then what I wanted to do, because I have a lot of technology that I've been working with my biofeedback work. There's so much more that I can do in person, or at least in a hybrid manner. So I've developed now my hybrid practice, where I do in-person assessments. They do some work remote, and that happens out of the clinic. That happens out of this new clinic that I'm working on. But I also said that because I'm not psychologist, and I don't have the basic musculoskeletal skills that I had 25 years ago, and I'm not a nutritionist, and I'm not a personal trainer, and don't, I like spending time in the gym, but that's not my profession. I needed to bring all of those people around me to support the work that I'm doing, and so that I can help them, and so on. And it turned into, okay, let's start an interdisciplinary clinic. And that's where Amplify Rehab and Performance came from, was my desire to bring like-minded people around me, so that we can support each other in a clinical scenario to best help the clients. And this is truly a client-facing clinic.
Right. There's two things that I want to say. Number one, I think it's really cool to have someone who's a prof who is currently clinically practicing, because I know a lot of times once people go into the research route, they give up their clinical practice. And a lot of times they're out of practice for so long that sometimes they can't relate to the difficulties of being a clinician, trying to implement some of the things that are being taught, or some of the things that they are teaching. So I commend you on that, because you're implementing it and putting it out into the practice, what you're preaching. So that's the first thing I want to say. The second thing I want to actually is more of a question, but you're doing a lot of neat things and a lot of unique things with your practice Amplify. I want to know the things that you're doing around biofeedback, around mindfulness. Did my computer just shut off? Okay, no, my computer's still
Oh,
on.
we
My
got you.
went off. All right, around all the other areas that aren't traditionally seen in physiotherapy practice, these things are foreign for most physiotherapists. Is this something that you are planning to then teach physiotherapists on how they can implement these tools into their practice as well? Is that something down the road? Is that something you haven't even thought of yet because you're so busy with 20 other projects? So, are there plans to maybe teach mindfulness, biofeedback, using the tools where you can monitor the parasympathetic, sympathetic system, all the things that you do, to other physiotherapists to adopt that into their practice?
Yes. Yeah, I mean, if I had a strength of anything in my life, it's as an educator. And any of the successes I've had in any of the programs and the things that I've done, it's been through my education initiatives, including all of these things that we're talking about. The biofeedback practice is really, it's about education. It's about educating the clients on their nervous system, and it's actually just using their data to educate them with. So I mean, it's still education. So yeah, I mean, I haven't developed anything yet, but I absolutely have been thinking about how to do this. The challenge for me is I am very acutely aware of all of the continuing education programs out there where there's charlatans that are just doing their own thing, selling snake oil and not having good evidence and experience behind it to make it real. Now, I believe in what I'm doing, and it's because it is evidence based, and that there's a very specific training process that can go behind some of this stuff. So I need to be sure that I approach this in a logical fashion. But I do think it's an area that is sorely needed in our profession and one that I think I can uniquely contribute to. So yes, short answer is that will be coming, but the timelines are unknown.
Yeah. I'm interested, just because I've always wondered why we don't use more biofeedback in clinical practice when we have all these other outcome measure tools that we use, but one that specifically is looking at something pretty objective, right? It's a tool that would be pretty objective. Why that hasn't been incorporated in physiotherapy practice after all these years that physiotherapy has existed. We've had clinics for so long, and that hasn't translated into real life practice yet. So very cool
Um,
that you're doing that. I'm interested to see how your clinic works out, what things you learn from it using this in real practice.
Thank you. Yeah, and I'd be happy to share how things go over time. If I can answer your question, I have two answers to the question as to why this hasn't happened yet. One is that we just haven't had the exposure to it. I mean, it's a little bit on the muscle biofeedback, the EMG biofeedback, like that's come into the curriculum a little bit, but the other stuff, the breathing and the heart rate variability is it's gained. I mean, heart rate variability has gained a lot of popularity lately, just with the implement of being able to measure it in wearable trackers and things like that. But so that'll be coming. But the bigger and probably more important answer is biofeedback is about behavior. It's not about, I mean, it is about the numbers and it is about the physiology, but in order to change the physiology and modify the physiology, it's about behavior. Now, you could argue that that's the exact same thing as anything else that we do is behavior change. I mean, physiotherapy is a behavior change business to a significant extent. But along with that, you have to recognize that it's not just about changing behavior, it's about the psychology behind it. And that's the rub, I think, in when it comes to a lot of these things. There's too much psychophysiology. So the combination of how psychology and physiology work together, that to be honest, I think people, when they see these things, they immediately think it's outside of our scope of practice, which it clearly is not, because we're doing this all like teaching someone how to feel their muscles contract when they're doing an exercise. That is a form of biofeedback, which is a psychological behavioral technique. So it is actually no different, but the perception and the research that goes into it is almost purely from the psychology side of things and much less from the physical and the physiological side of things. As that research shifts, I think there'll be more and more people wanting to implement these things. But right now, it's seen as a psychological domain, unfortunately.
Yeah, I imagine that if someone were to uh, get some biofeedback, we're able to see some objective measures, that it would be an easier sell to move someone from maybe a contemplation phase to more of an action phase. So I think it sort of actually can facilitate that behavior change as opposed to being the reason why someone might not, be willing to incorporate biofeedback into their practice. So I could see it work the other way as well, where in fact it actually helps facilitate that behavior change. I think that's something that's often a difficult sell to try to have someone change their behavior. But if they can see measurable changes, it's not something that they're imagining then. So I think they get to buy in a little bit more. And I think that's the main reason why I think it should be incorporated into physiotherapy practices more than it currently is. In fact, it's not at all. It's not at all. We don't do any of that. It's more, you're getting better. It'll take time. But if someone saw that they're getting better, and there is something that you can measure and show them, I think there's going to be a lot more buy into that. So
Totally.
I'm still a little bit confused as to why this trend has taken so long. And physios love technology. They love to have some sort of fancy device that they can use in their practice. So it all seems like the perfect thing for physios, the thing that they would easily adopt. Whereas maybe biopsycho social approach for a lot of people might be a little bit woo woo, but this seems like an easier sell. So that's where I'm a little bit perplexed as to why, big word there, perplexed, but perplexed as to why it hasn't been incorporated after all these years into physiotherapy practice. Whereas strength and conditioning has been using it, other fields have been using this, but not so much physiotherapy.
Yeah. No, I mean, you're not wrong. I mean, that's why I use it. That's why it works. That's what I believe in terms of what I'm doing with it. It's yeah, it's interesting because I the people that I talk to, because it's framed in such a psychological fashion, because it came from psychology, not from the physical and the physiology side of things. Like
Mhm.
all of these practices were psychological practices in the outset. I still think that there's this wariness and uncertainty around scope of practice. Although I agree with you completely, is that this is squarely within our scope of practice as physical therapists. I just think that there's enough of the even some of the education around it is planted in psychology, and so I think there needs to be a little bit of a change in the way that we learn this. Potentially, that'll make a difference, and maybe that it takes a physiotherapist who's in this area to develop a teaching program to teach physios.
Yeah, we got him on this show. Lucky for us.
Yeah,
There we
Yeah.
go. Awesome.
hopefully that'll
Well,
come soon.
definitely. We'll be right behind you on that. Well, Scotty, to wrap up here, I feel greedy asking you this question, but are there any last pieces of advice or words of wisdoms, perhaps maybe something that you wish someone told you back in the day? And I know you've already given us over an hour and a half of it, but if there's anything left in the tank there, please share.
I got lots. I got lots left in the tank. Let me summarize my sort of the main thing that I want people to take away from. Physiotherapy is an amazing profession. It's well worth getting into, but you also have to take care of yourself and put yourself in the forefront of what you're doing, and that means well, the full realm. It means biologically, psychologically, socially, financially. Prevent burnout, take care of yourself, uh, be willing to take some risks as part of that too, because a lot of the things that you're going to hear as you initiate physio school and get into clinical practice, um, I mean, you don't want to be challenging every single person that runs across your, at some point in time, you have to pass the tests, right? And, so there, you have to find a balance between striking uh, the flames of evidence versus, traditional practice. And sometimes you just have to do what you're told to pass the tests. But never lose a sense of curiosity around, is there a different way that we could do this that might be better evidence based and maybe more clinically appropriate? Because certainly the way that we've always done things is not an excuse to just continue to do things the way that they've been done. And so it takes some out of the box thinking, and I would encourage people to continue to do that.
I love it.
Awesome. Well, thank you so much for all your insights, not only on U of S, but also the profession as a whole and where we've come from and how we got here. Before we go, do you have anything to plug, anywhere that people can reach you? They can find some of your courses and your clinic and some of the other projects, your million other projects that you're doing.
Yep. Best place is Instagram, because then that links with everything else. So you can either find me at the Strength Jedi or at the Stoic Tiger.
Amazing. We'll put that all in the bio, all in when we post all this on our social media. It'll be blasted all on there. So, hopefully you get some people reaching out and chatting with you, because I think, of course, there's so much more to talk about, and I'm sure there's a lot of people curious, even more about what you do. So, Really, really, really appreciate you coming on. You're really helping us trailblaze with this podcast here. Like Cash was saying, first faculty member on here, so this is amazing. Hopefully, we can
Well,
continue
I
this trend.
I feel really honored to be your first faculty member, and yeah, you guys are doing some great work with this, and I really hope it's successful for you, and hopefully you get more faculty willing to open up and share some real stories, real talk.
Exactly. Yeah. No, really appreciate it, Scotty. All
No
right, guys.
problem.
Well, thanks for listening. If you enjoyed this episode, please, please, please consider liking, subscribing, sharing. And of course, even if you want to leave us a 5-star review, please do that. All of these gestures definitely help us continue to put out the best content for you guys. So thanks again for tuning in, and we will see you at the next podcast.